appreciate that. I'd like to share with the Minister about another constituent of mine, Noor Ayesha. Noor is battling an incurable rare cancer. For it, she requires an oral drug. The name is Pemazyre. It's been approved by Health Canada, but is not recommended by the Canadian Drug Agency for public coverage. So Noor's oncologist recommends she take this drug to help her live longer, but it costs $800 per tablet. They have to be taken daily. It's a cost of over $15,000 per month. Here's what Dr. Jennifer Knox, a medical oncologist at the Princess Margaret Cancer Centre, professor of medicine at the University of Toronto, here's what she had to say about Pemazyre. Quote, "This drug represents real progress, a key scientific and clinical advancement." Noor's family has had to turn to starting a GoFundMe to help her fight cancer and live longer because the Canadian Drug Agency hasn't recommended Pemazyre for coverage. My question for the Minister is, what steps is the government taking to address this gap between Health Canada's approval of rare cancer drugs and the CDA's recommendations for public coverage to ensure that patients like Noor can access the treatment they need without prohibitive cost?
The Honourable Minister.
Thank you, Madam Speaker. And in the first order, I want to say through you to the member and to Noor how sorry I am that she's going through this, and to her family, and how dreadfully difficult it would be to get that diagnosis and to live with that condition, but then have to worry about her medication on top of it. And we do have action on drugs for rare diseases. We're negotiating now with provinces to try to identify what drugs we can see to help folks who are in these conditions where there are a rare condition with rare drugs, so that they can help deal with these extraordinary costs. But it's one of the reasons why it's so important that we take the collective action we're taking with pharmacare and take these steps, because we do need to get to a world where everybody gets the medication they need and they're not in the kind of situation you're describing that Noor was in, or that the member was describing Noor was in.
The Honourable Member.
Thank you, Madam Chair. Can the Minister share more about what can be done working with provinces and territories to address this seeming gap? The issue why it seems like Noor can't access is, of course, because it's approved by Health Canada but not listed by the Canadian Drug Agency as a recommended for public coverage. Can you share more just briefly about what can be done working with provinces and territories to address this?
The Minister has 25 seconds.
Thank you, Madam Speaker. And given the level of specificity, perhaps the member could send me the specific details and I can get directly back to him. I want to be precise and I want to be able to dig into the specific circumstances as it relates to that exact drug. It's a very fair question. I want to be able to do that for both him and for Noor.
The Honourable Member.
Absolutely be happy to do that and appreciate the specificity.